Hi everyone, welcome to my presentation. My name is Lindsay Carricker and I'm a dietetic intern for Nicholls State University. Today I'm going to give an overview of aromatherapy and discuss some research I found that supports aromatherapy and integrative functional medicine. Aromatherapy is otherwise known as essential oil therapy, and it's defined as the art and science of utilizing naturally extracted aromatic essences from plants to balance, harmonize, and promote health of the mind, body, and spirit. So where do essential oils come from? They are extracted from all parts of the plant, from the flowers to the roots, and I have some other sources of where they come from here. They are extracted by mechanical cold pressing or through steam distillation. So how are essential oils administered during aromatherapy? They're administered through inhalation or by topical application. And I hope you remember some anatomy and physiology because I'm about to briefly cover the pathway through which essential oils produce an effect on the body. When an essential oil is inhaled, it triggers olfactory stimulation and the response is processed in the brain. The amygdala produces an emotional response, while the hippocampus retrieves memories or forms new ones. Then the limbic system interacts with the cerebral cortex. This enables thoughts and feelings. While this process is happening, the enabled molecules are simultaneously traveling through the respiratory tract, into pulmonary circulation, the bloodstream, and eventually reaches organs and tissues. Topical application through the skin goes through the same process but in a different order. And I thought this was important to explain because this demonstrates how essential oils literally impact the mind, body, and spirit. Aromatherapy has been used for thousands of years for medical, spiritual, and cosmetic purposes as early as 2800 BC. And these are just a few of the countries around the world that have used aromatherapy in history. And I have an example to explain that. This is a picture of an Egyptian wall painting, and the stone jars that are held in this painting contained essential oils. In fact, when jars like these are found today, you can still smell the oils that were contained in these airtight jars. IFM and aromatherapy go hand in hand for a few reasons. First is the mind, body, and spirit approach of IFM and what we just learned about how essential oils function in the body. Aromatherapy is frequently used by IFM practitioners as complementary and alternative therapies for patients with illnesses. Essential oils are low cost compared to other Western medical treatments, and there are less side effects associated with them. They are also often used to increase patient satisfaction in healthcare settings. It's important to note that essential oils should be handled as medicine. The FDA says they are generally safe, but there are a couple things to consider when using them. The first is quality. You want to use essential oils that are of therapeutic quality and are from reputable sources. Look for brands that are using organic farming, oversee the distillation processes, conduct independent testing, and follow the standards of quality. For example, organic gardening is something to look for because if you think about a crop that's being sprayed with pesticides and other chemicals, that's being highly concentrated within that potent essential oil. So it's probably not a good idea to be inhaling and applying these oils to our body that are not organically farmed. The second factor to consider is dilution. Most essential oils are diluted with a carrier oil such as almond oil, olive oil, etc. If you're applying essential oils topically, skin testing is advised in combination of dilution with a carrier oil. And the last factor is side effects. As I mentioned before, essential oils should be treated as medicine, and IFM practitioners and patients need to be aware of the implications, side effects, and interactions just as someone would a medication. I found quite a few peer-reviewed articles about aromatherapy, so I'll briefly discuss them and what their outcomes were. The first one was a meta-analysis and systematic review on pain. And these researchers found that aromatherapy was effective in treating post-op, gynecological, and obstetrical pain when used with conventional treatment. The second was a mixed method feasibility study on anxiety and sleep. They found that half of the patients in the hematology-oncology unit wearing overnight lavender oil patches experienced a reduction in anxiety and had increased sleep quality and duration. The researchers concluded that the aromatherapy intervention promoted increased patient satisfaction and quality of care. The next study was a randomized controlled trial by researchers Choi and Park. They found that an essential oil blend of sandalwood, geranium, and almond oil inhaled for 5 minutes 2 times a day significantly reduced PAR, which is perennial allergic rhinitis, and it reduced the symptoms in adults while improving the quality of life, sleep quality, and fatigue in these patients. The fourth study's focus was on selective attention. These scientists performed a study and concluded that an essential oil blend of rosemary, sage, and lavender significantly changes brain activity and created an enhanced functional connectivity during tasks. They suggested that this may be a helpful intervention for those with neural disorders such as ADHD and autism. The last study was a 4-armed randomized controlled trial, and they found that an essential oil product called Aromastick significantly improved cognitive vigilance, scanning speed, and increased heart variability and blood oxygenation compared to Red Bull energy drinks and the controls. So these are just a few examples of how essential oils can help people with a wide range of problems or illnesses. As future dietitians, it's a good idea to be knowledgeable of aromatherapy as it becomes more prevalent in the United States and in healthcare practices. And here are my references. If you're interested in looking further into the research content in this presentation, they are listed here. So thank y'all for listening and have a great day.